Most pregnancy-related deaths in the U.S. are preventable. That's what new data from the CDC shows. The agency says 80% of deaths could have been avoided with reasonable changes made by healthcare providers, the community, the patient, or others. Health officials say the findings highlight the need for improvement initiatives in states, hospitals, and communities that ensure all pregnant women have access to care. 3 News Now reporter Alyssa Curtis is live in our newsroom with more. Alyssa?
Yeah, Mary, that recent study found the causes of maternal mortality vary due to race and ethnicity. For those who identify as Hispanic, the leading cause was mental health. Same for those who identify as white. For those who identify as Asian, the leading cause of death was hemorrhaging. And for those who identify as Black, it was cardiac and coronary conditions. But the report found the overall leading cause of pregnancy-related death was mental health. What for some may be the happiest time of their life can be the scariest for others.
A lot of women do suffer in silence and unfortunately, for whatever reason, don't get the help and the care that they need.
There's a range of mental health conditions someone can experience during pregnancy and postpartum, with postpartum depression being the most talked about.
There's a continuum, and so it's just really good, I think, for women to educate themselves and to be aware that it might be depression, and they might have those feelings of, sadness and typical depression, but it could be something else, and it might not feel right, and it's worth talking to, your physician about.
Amanda Shrout, an outpatient medical social worker with Nebraska Med, says the best thing to do is be aware of your feelings and don't wait.
I'm sure it'll get better when the baby's 2 weeks old. I'm sure it'll get better when the baby's 6 weeks old. Just to not put those things off, because we do know that the sooner a person can get help, likely the quicker they'll feel better.
Another thing that shouldn't wait during pregnancy, follow-up appointments after complications. A pilot program in Nebraska run by Sync Health is working with federally qualified health centers to ensure medical providers are getting immediate updates about their patients if they visit an emergency room. Right now, it takes a while to get that information transferred.
If they don't find out until several days after, it's much different than knowing, hey, you were in the emergency room last night and we need to get you back in here and make sure that you're getting the care you need.
They're hoping, just like with mental health care, the sooner a patient receives care, the better the outcome. Nebraska Medicine offers a monthly support group for expectant and recent mothers. It's called Lean In. The group is open to everyone, not just Nebraska Med patients, and they meet over Zoom. You can find more information on the group and other resources at our website, 3newsnow.com. We're now reporting in the newsroom, Alyssa Curtis, 3 News Now.